Medicine, Public Health and Nursing Gajah Mada University, Mrs. Haryani FK-KMK, Doctor of Philosophy, the Honorable Supervisory Board of Nursing Student Association of Faculty of Medicine, Public Health and Nursing, Mr. Purwanta SKPMK. Furthermore, all of the participants who participate in webinar Hilarius 2021 and all of the committees who have been prepared this event as well. It gives me such immense pleasure in welcoming all of you to the last part of various events of Hilarius 2021, webinar Hilarius with New Horizon of Integrated Treatment of NCD, non-communicable disease during the pandemic COVID-19 as the theme. This year, Hilarius successfully held the very first international competition and talk show initiated by Nursing Student Association. Hopefully, through this webinar, we, as a future of health providers, can give better treatment to our patients with a lot of innovations, especially in pandemic COVID situation. Last but not least, I hope all of you can enjoy today's discussion and can take a lot of information and knowledge to be implemented in daily life. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much for Anissa Eka Banuati as the chairman for the welcoming remarks.
This was followed by remarks by the head of the Nursing Science Study Program at Universitas Gajah Mada, Mrs. Haryani, Bachelor of Nursing, Master of Health, Doctor of Philosophy. We invite you.
Good morning, the speakers and all of the participants. I am Haryani, the head of Undergraduate Nursing Program, Faculty of Medicine, Public Health and Nursing, Universitas Gajah Mada, Yogyakarta. We would like to thank all of you for joining this webinar with the theme New Horizon of Integrated Treatment of NCD during pandemic. During this period of COVID-19, actually, we would like to conduct this event offline so we can interact with each other directly. However, to the high uncertainty of epidemic relief and fear of cluster infection, so we conduct this event as a virtual activities. During this webinar, we will learn from experts. Thank you for Prof. Sing Mei from National Cheng Kung University, Taiwan, Professor Yayi Surya Prabandari, and Mr. Anggi from Faculty of Medicine, Public Health and Nursing, UGM. As we know that controlling NCD is challenging, and NCD still become a challenging health problem in our country. So, from the expert, we will get valuable information as well as experiences what they did to control the NCD. Also, thank you for Himpunan Mahasiswa Ilmu Keperawatan and Hilarius Committee who organized this event. We hope this event will run smoothly. Again, enjoy this webinar and thank you. Good morning, the speakers and all of the participants. I am Haryani, the head of Undergraduate Nursing Program, Faculty of Medicine, Public Health and Nursing, Universitas Gajah Mada, Yogyakarta. We would like to thank all of you for joining this webinar with the theme New Horizon of Integrated Treatment of NCD during pandemic. During this period of COVID-19, actually, we would like to conduct this event offline so we can interact with each other directly. However, to the high uncertainty of epidemic relief and fear of cluster infection, so we conduct this event as a virtual activities. During this webinar, we will learn from experts. Thank you for Prof. Sing Mei from National Cheng Kung University, Taiwan, Professor Yayi Surya Prabandari, and Mr. Anggi from Faculty of Medicine, Public Health and Nursing. As we know that controlling NCD is challenging, and NCD still become a challenging health problem in our country. So, from the expert, we will get valuable information as well as experiences what they did to control the NCD. Also, thank you for Himpunan Mahasiswa Ilmu Keperawatan and Hilarius Committee who organized this event. We hope this event will run smoothly. Again, enjoy this webinar and thank
We would like to thank Mrs. Haryani for the remarks that have been given.
We would like to remind all participants to change their identity with former real name underscore institution. And if it is possible, please turn your camera on and turn off your microphone during the webinar. The next event is the presentation of material from the keynote speaker as well as discussions which will be guided directly by Mrs. Aryani Arista Putri Pertiwi, Bachelor of Nursing, Master of Advanced Nursing, Doctor of Nursing Practice as moderator. We will introduce a little bit about Mrs. Aryani. The committee is welcome to display the CV of Mrs. Aryani.
Okay, so Mrs. Aryani Arista Putri Pertiwi, Bachelor of Nursing Nurse, Master of Advanced Science, Doctor of Nursing Practice. She's one of the lecturer at the nursing program, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. She graduated Bachelor of Science in Nursing at School of Nursing, Universitas Gadjah Mada. She also graduated Master of Art in Nursing from Nursing Administration, College of Nursing, University of the Philippines, Manila. And she also graduated Doctors of Nursing Practice from Health System Leadership and Informatics, College of Nursing, University of Illinois at Chicago. She has several certifications such as Good Clinical Practice in 2018, also Healthcare Interface Design from University of Texas Health Science in 2016, and also Basic Life Support from American Heart Association in 2014. She also got several appointments such as Secretary Undergraduate Nursing Program, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, and also Secretary of Department Basic Nursing and Emergency, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, and other appointments. She has a lot. And also she has several research and publications, such as using heuristic evaluation to improve sepsis alert usability in 2018, and also low utilization of telemedicine in the first year trial, a case in the province of West Papua, Indonesia in 2020. She also, and etc. She has many other research and publication that she released from 2019, 2018, and etc. She also has several speakers and invited lecturers experience, such as in 2021, she became panelist at the webinar Nurses at the Forefront of Change, Challenging the Status Quo at World Innovation Summit for Health and Nursing now in 2021, and also being the panelist at the webinar Bridging the Gap and Driving Momentum held by Nightingale Challenge Global Solution Initiative, and also other experience in 2020, such as optimalisasi peran perawat membangun ketahanan masyarakat dengan teknologi informasi. And also she has several honors and awards, such as Directorate General of Higher Education Scholarship Awardee from Ministry of Education and Culture Republic of Indonesia in 2014, and also Erasmus Mundus Staff Mobility Awardee from City University London, United Kingdom, and also other honors and awards. Now please welcome Mrs. Aryani. Good morning, Mrs. Aryani.
Hello, good morning. Hello, good morning, Echa. How are you?
I'm fine, ma'am. How about you?
Very good. Thank you.
Very good. Mrs. Aryani, how do you feel about today being the moderator of today's webinar? Maybe you can tell us.
Well, it is very exciting. Yeah, we'll learn together. We'll learn together,
Okay,
Echa,
sure.
about this
Thank you.
NCD. All right.
Okay, sure, ma'am. So, since the participant seems very excited about this session, without further ado, we'll leave the screen and time to Mrs. Aryani. Please welcome Mrs. Aryani.
All right, thank you so much, Echa and Diskan. Good morning, everyone. Very, very good morning. I hope you are all well. So welcome to the webinar. My name is Aryani. Thank you so much for joining us.
Okay, wait a minute because maybe Mrs. Aryani right now have technical issues. Please welcome Mrs. Aryani. Are you there? Hello, Mrs. Aryani. Are you there? Okay. Hello, Mrs. Aryani. Are you there? Okay. Welcome back, Mrs. Aryani.
Yes, I'm here. Hello.
Hello, Mrs. Aryani.
So sorry. Yeah, down at my house, unfortunately,
Okay.
but I so. Hello. Yes.
Uh, not clearly. We can hear you clearly right now.
All right. Can you hear me now, Echa and Deskan?
Yes, it is better.
All right. I'm so sorry. This is so unfortunate. I got electricity down here.
Wait, but I see your screen is black.
All right. So can we start now? Yes, I think so. All right. Welcome again to all of the participants. We are so grateful that Professor Yayi is already with us.
Selamat pagi, good morning, Bu Aryani.
Hello.
Yes.
Can you
Hello?
hear me?
Yes. Yes. I can hear you.
Test.
Yep.
Good morning, Prof. Yayi.
Yeah.
Yes.
Good
All right.
morning.
Okay. Yeah. Well. Very good morning. Okay, before Prof. Yayi start to present her presentation, I would like to introduce you to Prof. Yayi. Professor Yayi Suryo Prabandari. She is one of our lecturer here at Faculty of Medicine, Public Health and Nursing, Universitas Gajah Mada. She is one of my favorite professor, lecturer here. I'm one of her students. All right. So she graduated from her bachelor and master degree from the faculty of. She got her doctoral degree at community medicine from University of Newcastle, Australia, and she is now a professor and chair of Department of Health, Behavior, Environmental, and Social Medicine, Faculty of Medicine, Public Health, and Nursing. And also, she is the chair of Public Health Master Degree Program here, majoring on health promotion and health behavior. She also have a practice as the clinical psychologist at Happy Land Hospital in Yogyakarta, and this is why we invite her today, because she is the chair of Health Promoting University here at Universitas Gadjah Mada. And she will share with us her expertise about innovation and strategy on health promoting university to control NCD, one of the increasing number disease in NCDs right now. And universities, campuses is one of important places where all of us, I think, a place where I work, you as a student, so we spend a lot of time at campus, at university. So we cannot ignore, we need to have innovation and strategy, how to prevent NCD inside the campus. So Prof. Yayi, time is yours.
Okay, thank you very much, Bu Aryani, for the wonderful introduction. And I hope that you are also remain healthy, happy, yeah, and full of spirit today.
Amin, you too, Prof. Yayi.
Amin. Yeah, should I share my screen?
Yes, please.
Hang on. So could you already seen my screen?
Yes, it is clear.
Okay, and my voice is okay?
Very clear, Prof. Yayi.
Okay, so good morning, very good morning, selamat pagi, Assalamualaikum warahmatullahi wabarakatuh, salam sejahtera, shalom, om swastiastu, namo buddhaya, salam kebajikan, and salam sehat, so healthy greeting. That's not only very good morning, but healthy greeting. And today I would like, my time is 30 minutes, Bu Aryani?
Yes.
Yes. Okay. I hope that I can make it in 30 minutes. All right. The title that given to me by the committee, and thank you for the committee, the Himpunan Mahasiswa Keperawatan, and as well as the Hilarius committee for inviting me and to share about the health promoting university today to all of you. The Health Promoting University has already been declared by the University of Gadjah Mada in 19th of July 2019. So, but before, I would like to explain some of the NCD things. So I would like to tell about the effect of the NCD and then the impact of the COVID-19 to the NCD management. That's because I don't have my own data, so I will cite it from the WHO. And then the role of HPU, or Health Promoting University, in controlling and preventing NCD. Then health promotion strategy, and the use of the information technology, and actually the challenge for giving education or for campaigning about healthy behavior, yeah, to tackle the NCD. This is the cause of death in 2019 globally, yeah, because the 2020 I like to explore or searching. That I found is this one, yeah, but this one is not really different with the case in 2000. Yeah, stroke is still number one, at the global level, 7 out of the 10 leading causes of deaths were the non-communicable diseases. So that's why the Hilarius choose this topic for today. And as you maybe already read in the some information, yeah, hopefully journal too, the COVID-19 worsening by the comorbid as the non-communicable diseases. So if you have diabetics or heart disease, it is increasing the risk, yeah, of the severe of the COVID-19 or getting the virus. So these 7 causes accounted 44% of all deaths, or 80% of the top 10. So the diarrheal disease and the hang on, which one is the another communicable diseases. So all, if you see here, so ischemic heart disease, stroke, chronic obstructive pulmonary disease, and then lower respiratory infection, trachea, bronchus, lung cancer, Alzheimer disease, and other dementia, diabetes, and kidney disease. Those 8 of the diseases that non-communicable diseases. But all of the non-communicable diseases together accounted for 74% of death globally in 2019. And for Indonesia, I think the pattern is not different. And if you see the pattern here, that comparing the data from 2009 to 2019, so 10 years, that amazingly the diabetic increasing almost 50%. So 49.9%. Then followed by the lung cancer. The lung cancer is before was in the 13th rank, but increased to the ninth rank in the world, as not in the world, in Indonesia, as a cause of death. If you see here, stroke, ischemic, diabetic, cirrhosis, COPD, hypertensive, lung cancer, those are the non-communicable diseases. And if you see the one that decrease is the communicable diseases, tuberculosis, and then diarrhea, and then lower respiratory infection. But we we first met the communicable disease COVID-19 last year. Yeah, so before we are shifting from communicable diseases to non-communicable diseases. Then in 2020 we meet again with the communicable disease. This is still Indonesian pattern, Indonesian fact about NCD. And from the whole things, the proportional mortality is 35, caused by the cardiovascular diseases, then followed by the communicable maternal perinatal nutrition condition. This is still a problem in Indonesia. Yeah? And if you see this graphic, this is among the females. Yeah, it is lower than the male. Yeah, but the number is steady since 2000. So as I show you the cause of death of Indonesia, yeah, from 2000 to 2019. And if we see the national basic survey, Riskesdas, Riset Kesehatan Dasar, so basic survey from Indonesia, the pattern is also not really different. Those are from the word metric, yeah, that I got from the number of 2009 to 2019. But this one is coming from the Riskesdas, and comparing the Riskesdas 2013 to 2018, they do the survey every 3 years, and then the year 2001 not yet published. And if you see the hypertension increasing, yeah, the prevalence of NCD, and then followed by stroke, yeah. But this one, I think stroke, diabetic, I think worsening by the hypertension. Yeah. And then kidney failure also increase, heart disease steady but not decrease, cancer increase, TB unfortunately is also steady. I didn't take all, yeah. So I just this the rank, the 7 rank on the prominent diseases in Indonesia based on the national survey. And when we talk about the non-communicable diseases, actually based on the literature, you can prevent, because a lot of risk behavior that related to the non-communicable diseases. But before I show the risk behavior in Indonesia, this is the definition. So in order to be able to talk about risk behavior, so a person must expose him or herself to a non-negligible possibility of injury or death, of damaging his or her own future. So this person putting this or his or her health in the danger means the danger for health. Yeah. Similar concept is at risk, but at risk is more than risk behavior. If I show you with the example, parachuting is a risk behavior because if you cannot predict the wind, yeah, so sometimes the wind is also influence the smoothing of the parachute. Yeah, so parachuting is risk behavior. If you also register private insurance, you will ask about your hobby, and one of the hobby that make your payment to the insurance increase is the parachuting, yeah, paragliding, parachuting, yeah. So parachuting is already risk behavior. While if you do it and then waiting until the last possible second to deploy the parachute, so when you pull, yeah, to deploy parachute, but just close to the line, so this is putting you at risk, yeah. Your and some people do like that, yeah. Smoking is risk behavior, but more than 3 packs cigarette, yeah, and then not eating well. So this is putting at risk not only risk behavior, but at risk, more than risk behavior. This what I found in the WHO web. That's still the data in 2016, but I have the word metric of Indonesia about risk factor. We still have or facing the physical inactivity, salt and sodium intake, tobacco use, blood pressure, yeah, obesity, yeah, and then as well as the pollution. And if I show you this one, is the same source on the word metric from 2009 to 2019, as the diabetic increase, and here high fasting plasma glucose also increase. What tobacco also increased 20% compared to the 2009. And the malnutrition fortunately has already decreased, but the other things, high blood pressure, and then dietary risks and kidney dysfunction is all are increased. This is the current tobacco smoking in Indonesia. We hope will be decreased, but the tobacco control in Indonesia is still limited and need to be strengthened, yeah, with the health promoting universities. So if the young not starting smoke, yeah, especially for the youth, yeah, but it's better starting since the junior high school or senior high school, but it's okay, we strengthening in the university. So that's why the university should be smoke-free campus. Yeah. And then when we see here, the obesity and the overweight actually in the riskus deaths has increased in the last 10 years. Yeah, so all the weight of Indonesian people has increased. So this is worrying actually. Yeah, because we like fried things, yeah. Everything we fried it. According to WHO in 2018, the risk factor of NCD are those kind of behavior or habit. So this is modifiable actually, because you can ask to the people and then trying to modificate this behavior. Tobacco use, physical inactivity, unhealthy diet, and the harmful of use of alcohol. Those are increase the risk of NCD. If you see here, tobacco accounts over 7.2 million deaths every year, while the excess of salt. So if you like salty things, yeah, the savory food, yeah. So this is 4.1 million annual death that related to the intake of the excess of the salt, and more than 3.3 million annual death is also attributed to alcohol, while 1.6 million deaths attributed to insufficient physical activity. So, as a young people, I hope, and maybe I recommend for all of you to do physical activity as the WHO campaign. And this also the 4 key metabolic changes that increase the risk of NCD2. The blood pressure, the overweight, hyperglycemia, hyperlipidemia. Yeah, but I think all of this is related to physical inactivity, related to your diet. In terms of attributable death, the leading metabolic factor globally is elevated is blood pressure. Yeah, followed by overweight, obesity, and raise of blood glucose. And I found one study that done in 188 countries during 1990 to 2013 that indicated this reported that 90% of stroke burden, this stroke is the first cause of death in Indonesia, yeah, is attributed to modifiable risk factor, smoking, poor diet, low physical activity, as well as, like the report from the WHO, the cluster metabolic factor. Yeah, so similar to the WHO. But this one is the study that done in 188 countries, yeah, during 13 years. And when we face the COVID, yeah, so how about the non-communicable diseases management? Because the non-communicable diseases is a chronic condition, so needs to be managed, yeah, and not only once, but several times the patient should visit the healthcare facilities regularly to check their condition, yeah. Because in the national insurance in Indonesia, the non-communicable diseases patient include in the what they call Prolanis. Yeah, Prolanis is a program for the chronic patient. Yeah, that makes them have to visit the healthcare facilities regularly. Yeah. So this is the rapid assessment of WHO, how the impact of pandemic to NCD services. Yeah, this is done in all countries, even though not all countries. Yeah, so this is the member from the Southeast Asian. So SEAR is maybe ours is there, but I'm not sure. I'm not checked that Indonesia already included. But this is show that they a little bit impact, yeah, for the management. So this is percentage country with Ministry of Health or equivalent institute staff with responsibility of NCD and their risk factor being reassigned or deployed to help with COVID-19 response. Yeah. Yes, some. This is the most. This one is the not navy blue. This is the light blue. The light blue show this is the highest percentage. Yes, they are some, yeah. That is yes. Some of them, the percentage of the staff also tackle the COVID-19, but this is also still doing the routine NCD activities. So a little bit impact, but not for all the staff. And FC here that when they ask about the continuity of the service of NCD, they said that mostly, fortunately, yes, except in the low-income country. And our Indonesia is including in the upper middle income. or lower, no, upper middle income. Yeah. So we hope that we still continue the NCT, as well as I observe actually my friend who are including in Prolanis, she still can go, yeah, even though with the very strict protocol, that she still can check her glucose level. She is diabetic. My friend is diabetic. And when we see
Prof.
about the
Yayi,
countries,
I'm sorry.
yeah,
Your time is about 13 more minutes.
yeah, I know.
Just to alert.
Yeah, thank you.
Thank
I
you.
thought that 5 minutes. No, yeah.
No. You
Yeah.
still have 13 minutes.
Okay. Yeah. Yeah. I also use the stopwatch here in my desk.
Cool.
Okay. So the South is Asian. I think all the NCT is already manageable. Yeah, and this one is why the cause of the disruption of NCT related services. Yeah, that the most is because of decreasing of patient volume due to the patient not presenting. Maybe they are afraid to go to the hospital. Yeah, and then the next is the dark blue. Dark blue is insufficient staff to provide service. Yeah, in some countries, in some region, yeah, they are the staff is going to the tackling the COVID-19 patient. Yeah, so this is the overcome of disruption. The most is trying to telemedicine deployment to replace the in-person consult, and also the task shifting. Yeah, in Southeast, the task shifting, the telemedicine, as well as redirection of patient with NCT to alternate healthcare facilities. Yeah, so a lot of the strategy. Okay, so I would like to tell you about the role of health promoting university. This concept is an approach to create a learning environment and organizational culture that enhance the health, well-being, and sustainability of its community and enables people to achieve their full potential. So healthy university hopefully will implement for student, staff, administration staff, and hopefully the leader in the university have the strong commitment and leadership. And then we apply the health promotion through the curriculum, research, environment, and also investing staff, and as well as preparing the student, yeah, to introduce them how to be healthy through the healthy behavior. So what kind of things? In the Asian University Network, we agree about the framework. The framework is on three things: system and infrastructure, thematic areas, and then health promotion areas. Yeah, thematic areas is zero tolerance on smoking, alcohol. So as I already mentioned, the risk factor of NCD is smoking, alcohol consumption. Yeah, and then physical inactivity. Then in health promotion area, we will campaign and we will do activities that related to health literacy, mental health, social interaction, physical activity, healthy and balanced diet, as well as safe sexual behavior, life and work balance, and healthy aging. But the university staff, the university director, and then the dean, so the highest structure staff, they have to think about the system and infrastructure, how they build the safe building, healthcare services, disabled friendly environment, yeah, as well as the capacity building, and don't forget about the finance, yeah. And as I already mentioned in my first speak, that the Health Promoting University in UGM, because we are the member of the Asian University Network, and I actually representative the Universitas Gadjah Mada to be in the health promotion network of the Asian University Network that we already discussed from 2014 to 2017. Then finally the UGM Universitas Gadjah Mada we declare in 2019, and we incorporate 5 key action areas in health promotion that we adopt from the Alma Ata and the Ottawa Charter Declaration. With the build healthy public policy, create supportive environment for health, strengthen community action for health, develop personal skills, and then reorient health services, and 3 basic health promoting strategy to enable, mediate, and advocate. I will show you that finally the Universitas Gadjah Mada took from the framework from the Asian University Network, but we not take all the things because we are just started. So at the moment, we choose 7 activities: health literacy, mental health, physical activity and mobility, healthy and balanced diet, zero tolerance on tobacco, alcohol, drug, bullying, violence, and harassment, and safe, clean, and green environment. And these are the activities until now from 2018 when we trying to prepare before the declaration. We already have a jogging track. This is in Faculty of Medicine, Public Health, and Nursing. And we try to develop the healthy canteen with the traffic light, what we call traffic light food. Yeah, so we put a sign on the food, red if you cannot eat this every day. So you can eat those kind of food once a week. And then yellow is you can have it 1-2 times in a week. And if green, so you can eat every day. So mostly the vegetables things include in the green. Yeah. And then we also have what we call Pospindu. Pospindu is integrated health post that measuring the blood pressure and then your weight. Then up to now, we already have 5 Pospindu in 5 faculties, yeah, including the campaign about mental health. And for Pospindu is also with the health literacy. Yeah. And we apply the health promotion strategies, and the health promotion is the process the healthy behavior, and through the health promotion we hope that the healthy behavior become the norm, the habit. Yeah. And in the last 2 decades, yeah, health promotion is actually not only health education but plus the policy. This one, if you see from downstream, that this is prevention, communication strategy, and to the policy. So that's why health promoting university we included the rector, vice rector, and the dean, because we need a policy through the university, policy through the faculty, yeah, to make the health promotion activities work. And health promotion still using the health education. And that's work in Indonesia is actually also the community empowerment. And inside the university, we can empower the staff and then the administration staff as well as the student. At the moment, we have 144 ambassador, what we call ambassador, that consists of the student from all faculties and school in University of Gadjah Mada. So they will work voluntary to strengthen the health promoting university. At the moment, they are still we still train them, yeah, every Saturday. So this also the strategy of health promotion. And we apply actually for the health promotion, the health promoting university with health education, mass communication, as well as the political action through the inside of the university. Yeah, this one I show you because the health promotion use the step from community analysis, target assessment, program planning and implementation, then evaluation. So last year, our health promoting university also trying to campaign about the health protocol, yeah, how to prevent the not only the NCD, but also the COVID-19 transmission. So we collaborate with the FISIPOL, the Social Politic Faculty Media team, to analyze the social media. This is community analysis. Then we put what kind of topics that discussed by people mostly, and then, for example, how to the sunbathing and how to use the disinfectant effectively. Yeah, and then we choose the channel, then implement and evaluate. So health promotion target, it's better that multi-level. So when we trying to change the healthy behavior on eating, for example, yeah, for eating or for all the healthy behavior to individual, we can give health education campaign, and through organization we can use the health promoting university. Through community, at the moment in Yogyakarta there are a few of the kampung or village that implement like smoke free kampung, and then the kampung sayur vegetable village, yeah, and we already have the regulation on smoke free, yeah, in Yogyakarta as well as in university. So if you see, the multi-level is based on the socio-ecological model. And I will a little bit faster. So the information technology as a medium promoting health to control NCD, I would like to take from the journal. Yeah. So this is the definition of the various of digital health. There is e-health, electronic health. There are m-health, mobile deliver health, and with the some kind of types, yeah, and then telehealth, telepsychiatry, telemedicine, yeah, and these are the research based on the digital health, yeah. The use of e-health and m-health tools to the prevention among older adults, yeah, so show that even though in elderly, they can still use the IT. And the digital intervention for the children and young people with mental health show mixed results, so it still need to be studied, yeah. And then for the promote the physical activity and healthy diets, yeah, this is a systematic review. Some research show that the electronic or mobile health intervention are effective in promoting physical activity and healthy diet in developing countries, yeah, but still need stronger studies. And smoking cessation support through SMS is also increasing the quit smoking. So the challenge of health promotion, yeah, actually when we deliver the health messages, have the community receive them. So we have to use several channels, yeah. For example, for the young people, for the certain population, we can use the social media, but in Indonesia, sometimes we need a dialogue, yeah, because not all people using the handphone. And then for the big people, the provincial, for the governor, for example, we need to advocate them. So when you see this one, yeah, sometimes the information, and then when the people receiving the information, the brain processing, yeah, and it can be coping or maladaptive coping, but we need to strengthen the information through, I will go back here, yeah, through the strategy, because if we face the challenge. So this is one of the model. So the two last slide, health play model that people sometimes will thinking about modificate their behavior or change their behavior if they have the perception that they are susceptible to suffer from the disease and think about the severity, and then they perceive threat. But because of the education here, yeah, hopefully they got that, okay, the prevention is better, yeah. Then they have, hopefully we increase their perceive of benefit, even though sometimes when people thinking about how to modify their diet or how to do physical activity regularly, they face barriers. But so that's why cues of action should be regularly also delivered to increase. And then there are also some studies that people like to receive the message that more on perceived benefit, than to perceive the susceptibility or severity. That's the time is so tight, and then people trying to change actually from pre-contemplation that not thinking, and then this is the strategy. Then for the people who are still pre-contemplate and contemplate, we can use the media, but after that we have to use the personal approach. So billboard is still okay. Then in the healthcare services, we need to use the standing banner, and then we still need to use the dialogue. So health education and small group. I think these are the last. Thank you. I think I more 2 minutes, Bu Ani. Hopefully it's okay, and thanks to anything. And you are the young people. Let's do something for people. Also a simple thing. So stop the hoax, and then just share about the good things about the prevention in NCD or in COVID-19. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Om Santi Santi Om. I give return back to Bu Ani.
Okay, Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Prof. Yai, for your presentation and very powerful message at the end. I think all of us get that, and we'll keep that in mind. All right, Prof. Yai, we will have a discussion session, question and answer. I believe the committee will help me to show some questions from the audience if we do have. It is very interesting. We learned from Prof. Yai presentation that there are some strategies used to promote healthy behavior at campuses, and at UGM we do have 7 activities that Prof. Yai mentioned, and I am amazed that it is interesting, Prof. Yai, because yesterday we had a science competition, so we have some participants from all over Indonesia, and we do have also participants from abroad. Some of them talked about post-bindu. And Prof. Yai mentioned that inside our campus, we do have post-bindu. That's very interesting. And until now, we do have ambassador, and Prof. Yai still conduct training for those ambassador. That's amazing. All right, I think I can see some of the questions here. All right, I will read one of them. Let's take this one. All right, we got a question from our friend from Unair in Surabaya. Okay, from Mas, I believe, Mas Ludiro, how HPU, Promoting University, is currently able to change the behavior of its campus community, especially at UGM Faculty of Medicine, Public Health and
Okay, thank you, Bu Adi and Mas Ludiro. HPU is still new, so we declare at the Faculty of Medicine, Public Health and Nursing, we started in 2018 because we trying to implement firstly because we need to show to the university, so the university will have strong initiation after they see the evidence from the Faculty of Medicine. But talking about the behavior change, we haven't had the data up to now, but what we see is the Pospindu that we already implemented before the pandemic, because starting in 2018. The staff in actually the administration staff at the Faculty of Medicine, the number of who are coming to the Pospindu has increased when we are doing. So even though not every month like in the community, I think every 2 months or 3 months, maybe Mas Anggi can also describe this. But the motivation to come and then to measure and screen their health is for me is makes me happy. And then what they ask in the 5th desk, Meja 5, yeah. They also asking about how to do the physical activity. And in technique, in engineering faculty, Fakultas Teknik, that's also amazing because not only in the administration staff, but also the staff academic, the docent, the lecturer, the lecturer, they also coming to the post-bindu. Yeah, and then they like very much, and they already develop the application. So the post-bindu not only writing, but just directly through the apps. Yeah. Then this one, hopefully in the next, we will have the survey for the next, because we already trying to advocate to the DSD, the computer things, in the university, that we hope that we can include, because we already preparing the survey, for the healthy behavior that should fill by the students and the staff, academic staff. Then we have the data every semester, but this is not an easy thing because we already advocate but not yet implement. So that's why we don't have any data at the moment. What we have is based on the survey that done by my students, my graduate program students, that show that the students are happy but not yet about the behavior. So I cannot answer now, Mbak Mas Ludiro. For Mbak Nia, that's I can answer directly, Bu.
All right,
because
all right,
I already,
okay,
I already
you can
read,
see it also, right? Yes, the questions.
How effective they use digital health promotion in handling CKD, apa ya? Communicable disease maybe, during the
chronic
kidney disease.
Kidney disease,
kidney.
Prof. Yayi. Yes, kidney, right.
I haven't found in the web at that time. I tried to find the systematic review about the using of digital health in health promotion in any, but what I found is about the healthy behavior, but not yet in chronic disease. Chronic disease? Oh, chronic kidney disease. So maybe you can find, but I haven't found any research that related. What I observed, because I have two students that doing the hemodialysis. So the number of patients in the hemodialysis is still increased, at the moment. But do they have to receive the campaign or education based on the digital health, or digital health promotion? So I haven't had any idea. But Prolanis, they also use the digital health, so to remind the member of the Prolanis. That's not specific the chronic kidney disease, but all the communicable disease. Mas Anggi, Mas Anggi also asking, what is the major barrier in initiating and applying for the health promoting university in university? So I think a few things. The first is how to advocate the university high body. I mean that the rector, the vice rector, at the first time, because at that time I returned back from Thailand from the meeting of the Asian University Network for the Health Promotion Network, that we have to commit to develop a health promotion or a healthy campus at the members of the Asian University Network. They are welcoming, but nothing happened. Just welcome. We need. So I talked with my dean, and fortunately, the dean of the Faculty of Medicine used to be the staff in public health, even though she moved to OBGYN department. So she is very, very strong to implement. So Bu Yayi, let's implement in the Faculty of Medicine first. Then after we do something, we advocate to the rector. So that's what we have done. And then to develop this one, we need to meet some of the staff and then trying to offer to the staff, to be the main team, to the main team of the HPU in the Faculty of Medicine. It also needs some effort. So we had a few of workshop in the beginning in 2018, and we try to implement. And I involving my student in the graduate program of health promotion graduate program. Then usually they have a field work outside of the campus, but because my dean asked me to let's try develop the health promoting university in the campus, so I send my student that working with the Faculty of Medicine, and then we also trying to a few of faculties, Faculty of vocational sekolah. Vocational school, and then Faculty of Social Politik, Faculty of Pharmacy, Faculty of Technique, Engineering, and then Faculty of Dentistry. Oh no, not dentistry, pharmacies, and food technology. Then because we are sending the graduate program students, so they work closely with the faculty, and then and it is different kind of development, because one of my group working with directly with the dean and vice dean, the other working with student, the other working with the association of wife Dharma Wanita in the one of faculty, because they will develop the canteen, and then the canteen running by the association of wife of this faculty. So a lot of things happen, but finally we already have the health promoting university. Not all faculties in Gajah Mada University already developed, but they are starting this year. We hope that they already have PIC, the person in charge in each faculty. Hopefully they also will have a team like the Faculty of Medicine, Public Health and Nursing. Okay.
Right.
Yeah.
Maybe
And
one
then,
more question.
This is Bu Haryani, or the culture in our society is very strong. One of which it's related to lifestyle, food, salty food, sugar, how to overcome the cultural barrier in dealing with NCD. Let's allow me to talk about the smoking, Bu, before I talk about this one. In Yogyakarta, before we develop the smoke-free village, it is in the Kalurahan and in the RW level, so I just call smoke-free village. Before, when they have a ceremony or function, like a wedding or a funeral, they always serve cigarette as well as the ashtray. And then after we work for almost 1 year, this is the culture, how to the hospitality of the host when the guest coming. One of the hospitality is serving cigarette. So we talk a lot, and now in some villages they already not serving cigarette as one of hospitality. So even though they can smoke, but they have to smoke outside of the house or a little bit have a distance with who are not smoking. But the host will not serve cigarette, will not serve ashtray. And this based on the community commitment. So I think with the culture of salty things and sugar things, if we trying to campaign that not changing the food, I mean that we still eat, for example, gudeg, or soup, but trying to decrease slowly, maybe we can have the motto of Yogyakarta, slowly, but it can be done, alon-alon waton kelakom. So it is English. In English, what is it in English?
Okay.
We have to move slowly, not directly. For example, in Philippines, they already apply in the big restaurant. They're not serving the salt anymore. We can find the pepper, but not salt. When I ask, so this is the policy from the government. So I think if we apply the policy, so trying to decrease the sugar in our drink, our food, and then also the salt. So I think it's okay. I already, because I try to do healthy living, so I already asked to the mbak yang that cook for me, for us, so to decrease the salt. So sometimes I eat in the restaurant, I feel that it's too salty because I used to eat that less salt, and I never use sugar in my drink. So I think I'm a Jogjanis. I also grew up with the teh manis, the very sweet teh, the very sweet tea. But I changed slowly. So now I can drink coffee without sugar. So I think if we have strong intentions, then we try to campaign, not changing the menu, but just decrease the ingredient. I think it's okay. Okay, Pooh.
Yeah.
I think this one that I can see.
Thank
that
you
I can
so
see.
much. Yes. Right. Also, our time is very close to end of the session. Thank you so much, Prof. Yayi. Yes. The discussion very interesting. Talking about the culture is like never ending. I know that you are so passionate with tobacco control in our nation, and I ever read one of your publication about that, the tobacco in the culture in village. That's and it struck my understanding that that is our culture, as you mentioned a while ago, that it is one of the hospitality of the community if they serve the cigarette. That's and it's a very hard, and it's I think it is important for us as a healthcare providers to aware that and try to contribute whatever we can do. All right. So about the health promoting university, we have discussed about the behavior. Prof. Yayi mentioned that we are moving toward that. Yeah, Prof. Yayi, step by step. Step by step, like a song that I like also. Step by step to health promoting university, involving all stakeholders from the administrator to the very in a very small unit. Every steps we empowered them to also contribute in the health promoting university. Right, very interesting. Thank you so much, Prof. Yayi. And maybe for our session closing, Prof. Yayi, together with us, the participants from, we have here our colleagues, faculty members, students from some universities in Indonesia, also abroad. So maybe you have suggestion for all of us, for our colleagues, our friends that who do not have health promoting university yet in their setting, maybe a suggestion about what should or how can they do to also advocate so that they will have also health promoting university in their setting.
Okay, thank you, Bu Aryani. To all of the participants, especially who are students, but hopefully they're also staff at university. So I believe that in some, or I think in all university, they already have the what we call the embryo, the starting things. So I think that regular physical activities you already have it, or maybe the club of the cycling club, So just develop based on what you have at the moment. Starting from small. So if I cited the Chinese probe, the long journey start with the first step. So if you have small things, trying to do it, and even very simple as you should start from yourself. Be healthy. And then you can offer to your friend, and then finally you have a group yeah, that applying one of the healthy behavior or two or three, yeah, hopefully all of them that I already mentioned as a risk behavior, then you started to do something, small activities, maybe in just in the faculty or in the study program. Then if you already have with this activity, that's what we have done, yeah. So showing the evidence that this is very good to be applied in our university, then we can advocate to the what you call administration or the high level of administration in the university. So like Pak Rector or Bu Rector or Vice Rector. Yeah, but we do something first. Yeah, and then even though only simple things, but it is very good if we start it. Yeah, before we are advocating this concept of health promoting university to the higher administration or a higher structure, yeah, in the faculty level or in the university level. But
All right.
yeah, that's it, Bu Ani. Yeah, so
Yeah, okay.
let's start from now, from
Yes.
ourselves. Yeah.
Yep. Okay, thank you so much, Prof. Yayi. It's a very wonderful morning with a fruitful discussion. Start from now, start from small, start from yourself. And another message from Western, I think, start from low-hanging fruit. Yeah. Whatever you can achieve now, start from there, and then you can advocate to the higher level. And hopefully one day we can achieve that, our ideal dream. All right. Thank you so much again, Prof. Yayi.
Yeah, thank
and
you.
Thank you so much, everyone, for your participation and attention. And this is the end of our first session. I turn back again to our MC, Deskan and Echa. Thank you, Deskan and Echa.
Thank you to Mrs. Aryani for successfully guide the session as moderator, and also Prof. Yayi, who has referred a very extraordinary material today. And furthermore, there will be a presentation of certificates and also documentation session for Prof. Yayi and also Mrs. Aryani. So for the committee in charge is welcome. The first certificate will be submitted to Prof. Yayi as the keynote speaker. The committee in charge is welcome. Okay. Thank you very much for Prof. Yayi for the engaging and also enlightening knowledge today.
Thank you. Yeah, I already received. Yeah.
Okay, we will take a picture at first. 1, 2, 3. Okay, thank you very much. And the second certificate will be submitted to Mrs. Aryani as the moderator. Okay, thank you very much also for Mrs. Aryani for successfully guiding this session. Okay,
Thank you. It's my pleasure.
We will take a picture at first. 1, 2, 3. Thank you very much, Mrs. Aryani.
You're welcome. Thank you, Deskan. Bye-bye.
Okay, thank you very much to Professor Yayi and Mrs. Aryani. If you have other needs, you are welcome to leave this room. And thank you again for the knowledge that has been given.
Thank you, Mbak. Yeah, maybe I just close my camera. Yeah. So.
Matur nuwun, Prof.
Yeah, matur nuwun.
Thank you very much, Prof. Okay. Next, once again, we remind you for participants who have no problem. For participants who have no problem, if it is really possible, please turn on your camera to enliven the event today. Okay. And next, the next event is presentation of material from the speaker as well as discussion, which will be guided by different moderator, namely Regita R. Maharatri. We will introduce a little about Regita. The committee is welcome to display the CV of Regita.
Okay, so we will read the curriculum vitae of Regita Rahma Maharati. Regita Rahma Maharati, Bachelor of Nursing, is the second most outstanding student from Universitas Gadjah Mada Faculty of Medicine, Public Health and Nursing Universitas Gajah Mada. She has a lot of achievement. One of it is being a gold medalist of poster category and also a representation on 33 Timas 2020, and also being a gold medalist in World Invention and Promotion Nigeria 2021. And she has a lot of leadership experience. One of it is being a head of content writer and graphic design team in Kalikasia startup PT Bestari Inovasi Kesehatan, and being a graphic designer team member at Social Media Management Division in ASEAN Youth Organization. She also has experience to be a project officer in FK-KMK in Action or KIA and head of public relation in Sekolah Media. The next, she's also having the experience to be inspirational resource person in the Poko Book Indonesia and being an ambassador for paid promotion BRI Fashion Scholarship through Instagram in 2021. And also having the experience to be a motivator in the student scientific work for webinar PKM and PINA Sesi 1, Shine Your Creativity for Breakthrough Achievement. And also being mentor for pelatihan IT using Adobe Illustrator at Student Council FK Universitas Andalas Padang in 2021. And last, the course and training. She selected to be the exchange student in the TUFH ISTAP program and also being the participant in World Health Organization seminar in the COVID-19 operational planning guidelines and COVID-19 partners platform to support country preparedness and response in 2021. And also having an intellectual property
Hello, Miss Regita.
Hello. Thank you, MC, for introducing me.
Hello, Miss Regita, are you there?
Yeah, I'm here. Does my voice is audible?
Yes, you are audible. Okay, how are you today?
I'm very good. How about you guys?
I'm fine, thanks. What is your feeling today to be the moderator in this Switch International event?
Oh yeah, it's a pleasure and a very exciting moment to together here, and we will gain new knowledge and also insight together here with expert speakers in their field.
Okay, great. So because participant is very excited to listen and also discuss the topic that will be presented by the speaker, I will give you the time to guide this main session. So without any further ado, the time and screen is yours.
All right, thank you, MC, for introducing me, and thank you for the time. Good morning, everyone. My name is Regita Maharatri, and I will be moderating this live panel discussion session. This is the panel discussion session, and the speakers are Mrs. Sing Mei Chen, Doctor of Philosophy, registered nurse, and Mr. Anggi Lukman Wicaksono, registered nurse, Magister Science Nursing. Maybe I will say hello to the participant of Hilarius 2021. How are you all? Of course, it is good and very exciting to listen more deeply to our webinar material this morning, especially with our expert speakers in their fields. Before we begin, I have a few housekeeping notes. Today's session is being recorded to be available for viewing post-conference at YouTube, Himika, FK-KMK, UGM. If you have any question for the speakers, please submit a question via Slido. The committee will send you the link in the Zoom chat feature. Each speaker today will have a total of 30 minutes for their presentation. If one of our speakers completes their presentation before their 30 minutes is up, there may be time for a question from attendees. However, we will hold most questions until the end of the session, and I will read the question out loud for the speakers to answer as the time permits. Okay, because all of the attendants can't wait to listen to this webinar material. Now let's look the profile of our first speaker, Mrs. Sing Mei Chen, PSG registered nurse, who will present material with the topic Home-Based Self-Care Intervention Education in People with Cardiovascular Disease during the COVID-19 pandemic. Please let me read the CV of Professor Sing Mei Chen. Professor Sing Mei Chen, Doctor of Philosophy, registered nurse. Got her PhD from the University of Texas at Austin, School of Nursing, USA. Got her MSN from National Taiwan University, School of Nursing, Taiwan. And got her BSN Kaohsiung Medical University, School of Nursing, Taiwan. And the current positions and employment of Professor Sing Mei Chen is as Associate Professor and also Adjunct Supervisor at Department of Nursing, College of Medicine, National Cheng Kung University, Taiwan. And the past positions and also employment was as Assistant Professor, Department of Nursing, College of Medicine, National Cheng Kung University, Assistant Professor, and Course Coordinator at Cheng Kung Institute of Technology, Taiwan. And she also got several honors and awards, and the one is at 2020 for Innovative Teaching Award, College of Medicine, National Cheng Kung University, and also have several publications referred and also conference paper with in total more than 40 referred paper range from 1997 to 2021. One of them is entitled Ethical Challenges of Non-Reading Older Adult Women's Autonomy in Receiving Percutaneous Coronary Intervention Under Familiar Paternalism in Taiwan. And the first, and also the conference papers, many of them, lots of conference paper, in total more than 60 conference paper. And the first, the recent conference paper entitled Determinants of Sleep Quality in Patients with Heart Failure among 3 ASEAN countries. And Professor Sing Mei Chen also became the primary investigator for project entitled Effectiveness of Incorporating Peer Support into Self-Care Intervention on Improving Psychosocial Factors and Clinical Outcomes in Patients with Heart Failure. Okay, that is the short introduction from the first speaker on the webinar. Really amazing. Without any further ado, let's please welcome our first speaker, Mrs. Sing Mei Chen, PhD registered nurse. Hello, good afternoon, Professor Sing Mei Chen. How are you?
Oh, fine. Just very busy.
Great. How do you feel in this webinar, Professor?
Again? Excuse me, I need to fix the audio.
All right, Professor.
Yeah. Okay, sorry. I have my students here.
No problem, Professor.
Okay, so what is your question again?
Yeah, Professor, how do you feel in this webinar? It's really good to see you here.
It's amazing. Yeah. And it's a pity that I couldn't attend the first speaker's presentation, but I think that is wonderful. I just wonder, are you undergraduate students?
Yeah, of course, but I'm a fresh graduate, Professor.
Oh.
Yeah.
Okay. I just want to let my students to know you are so smart,
right,
and they can learn from you.
Yeah, welcome to NCKU student there.
Yeah.
Hi, and good afternoon.
Okay. Okay, so...
Okay, Professor, because the participants here are also very excited to listen to your material. Time and place, I invite Mrs. Sing Mei Chen to deliver our first material. home-based self-care intervention education in people with cardiovascular disease during the COVID-19 pandemic. I will announce the time limits during the presentation. Professor Sing-Mei Chen, time is yours.
Okay, so thank you. I share my screen. So can you see the screen now?
Yes, it's clear.
Okay. Okay. And for outlines today, I will cover three issues. What is the cardiovascular disease and home-based self-care patients with cardiovascular disease and self-care support for patients with cardiovascular disease and caregivers during COVID-19 pandemic. However, because the time is very limited, and I prepare too much materials, so maybe I will stop if time is up. So what is cardiovascular disease? Actually, this topic is very big because cardiovascular disease is a general term, is an umbrella term for the conditions that will affect the heart and other vessels. And there are many diseases, not only here. We list only 5, the most common, including heart attack, or we call myocardial infarction. That is the formal name. And stroke and transient ischemia attack, TIA, heart failure, arrhythmia, and heart valve problems. So, and today, because we will use the general term cardiovascular disease, so I just focus on the interventions that is useful for the cardiovascular disease, not for a specific disease. Okay, and actually, cardiovascular disease is very important because it's the first killer, or it's a top 1 cause death in the world. And every year, around 18.6 million people die from cardiovascular disease, and it represents around 33% of the overall global deaths, and greater than 75% of the CVD deaths take place in the low and the middle income countries. And from the bottom here, you can see that CVD is the top 1 causes of death, and the top 2 is cancer. I think the trend is maybe it's similar in Indonesia. However, it's different. It's reversed in Taiwan. Our top 1 cause of death is cancer. Then the second is cardiovascular disease. Then many risk factors can cause cardiovascular disease, including high blood pressure, high cholesterol, and obesity. These 3 actually count, including diabetes. Okay. Here is count the metabolic syndrome. And recent years, the WHO or the Heart Federation also including air pollution into the risk factor, and physical inactivity. Then others like unhealthy diet, smoking, and kidney disease. Then overuse of alcohol. All are the risk factors. And for today, because the main issue is it's about the CVD and the COVID-19. Yeah, so what is the relationship? I think we already know many people, if they have a cardiovascular disease, it's much easier to get the COVID-19. Yeah, so based on the statistical data, currently we found that hypertension, diabetes, and obesity are the most common comorbidities in patients hospitalized with COVID-19. And also, if patients have those comorbidities, their mortality rate is increased. And for the COVID-19 people, infected population, around 8 to 25% they have cardiovascular conditions. Then, if we compare the patients survive from the COVID-19 and they die, it means non-survivors. We can see the trend. For non-survival people, they have higher chance in hypertension, diabetes, and the cardiovascular disease. So it means if the patient have hypertension, cardiovascular disease, it's much easier to die from COVID-19. And why? When SARS-CoV-2, that is mean COVID-19 virus, if the infection will trigger the disease called de novo acute and chronic cardiovascular disease. I will show you the figure about the mechanism later. Yeah, and acute cardiac complication in the arrhythmia, myocarditis, and the heart failure. These are significantly associated with the higher in-hospital mortality. Okay. This figure shows that the mechanism of de novo heart failure. What does mean de novo heart failure? It's the acutely worsened heart function without non-underlying heart disease. It means when patients come, they just know they have heart failure right now. They don't know they have heart failure. Okay, so that term we say new onset heart failure or undiagnosed cardiac dysfunction. Then you will cause disrupted coronary blood flow, myocardial ischemia, acute valvular incompetence, arrhythmia, or pericardial hemorrhage. Then also the toxin or the COVID-19 will cause the leg inflammation effects. All of them will lead to acute hemodynamic derangement. Then it will produce heart failure. And so here we know that maybe there are two possible mechanisms of myocardial injury from COVID-19. The first one is cytokine storm, caused by the COVID-19. Then we can see the patient, they have a higher interleukin-6, ferritin, LDH, and the D-dimer. A D-dimer is mean our body have, the patient's body have thrombosis or embolism. The second possible mechanism is the later effect by the severe acute respiratory syndrome, coronavirus 2, that is COVID-19, okay, on the heart. Yeah, so you can see here the myocardium already damaged by the COVID-19. And one thing, another issue we need to pay attention is about the COVID-19 will attack the renin-angiotensin system, the RAS system. Okay. As we learn from the pathophysiology or physiology, we know that the angiotensinogen will be converted by the renin into angiotensin 1, then angiotensin 2, then have the receptor in the angiotensin 2. Angiotensin 1 receptor, it will induce the vasoconstriction, something like that. Okay, and here before that, we learn angiotensin 1 will convert to angiotensin 2 by the ACE angiotensin here, right? Okay, and from the angiotensin 2 here, this one, it has another receptor called ACE2. It will convert the angiotensin 2 to the angiotensin 1 to 7. And if we go from this pathway and the angiotensin 1 to angiotensin 1 to 9, these two pathways, it will cause vasodilatation, antioxidants, anti-inflammatory, and antibiotics. Okay, so the green pathway it's good for body, but the red pathway have harm to the body, and they keep balanced. And if the patient starts the cardiovascular disease, the patient with cardiovascular disease usually will use two medications, ACEI or ARB. These two medications or either one. Okay, when they use these two medications, it means they will block some pathway, right? Okay, and when the patients get COVID-19, the virus will bind with the ACE2 receptor here. Okay, so it will block the green pathway. So originally, the green pathway can cause vasodilatation, antioxidants, anti-inflammatory, and antibiotics. Okay, but now this pathway will be blocked. Then what will be happen? Here, as I mentioned, the COVID-19 will bounce to the SCI2 in myocardium to enter the target cell, causing down regulation of SCE2, which will convert vasoconstricting inflammatory angiotensin 2 into vasodilating anti-inflammatory protein angiotensin 1 to 7. And this concentration of the 1 to 7 will decrease. Then the angiotensin 2 increases. Then it will lead to reduced coronary artery or cardiac ischemia and inflammation. And also the angiotensin 2 increased will cause vasoconstriction and elevate capillary bed. So it will increase the right heart, the stress on the right heart. Then it will increase the problem is hypoxic coronary vasoconstrictions and the microvascular thrombosis. Okay, so the mechanism can cause the patient in the higher mortality rates. And so for the long-term cardiovascular complications in COVID-19 patients, you can see if they are not hospitalized, it means they just have mild symptoms. So around 78% of the patients, when they just at the beginning of the infection period, around 80%, 78%, their heart already got involved, and 60% have myocarditis. Yeah, and but the risk will decrease along with the time. Here is 6 months. However, if the patient they admitted to the hospital, maybe they complain chest pain around 21%. But for 54%, they have LV, left ventricular dysfunction. And here, they have a fibrosis. LGE is a kind of contrast. And when it can show fibrosis on the heart, so around 54%, the patient already have fibrosis on their heart. Then myocardial infarction is 19%. So here, then even though 6 months later, around 5% will complain chest pain and 9% still complain of palpitation. Okay. So far, it's about the mechanism of the cardiovascular disease and the COVID-19. For that session, I just want would like you to understand why the COVID-19 can cause high mortality in cardiovascular disease patients. And next session is home-based self-care. In patients with cardiovascular disease. In this session, we'll cover 3 parts: self-care behaviors, and also I will talk about the telenursing, a little bit. Then mention family support system. The first one, the self-care behaviors in cardiovascular disease, including the first one, the very important is to reduce the sodium or salt use. Usually, we limit the salt use in 5 to 6 grams per day. And do you know how to calculate into sodium? It times by 40%. So if the patient 5 grams of the salt equals to 1,000, then it's 1,000 milligrams, 2 grams of the sodium. And because in Western country, they usually put the sodium on the table. So here they encourage their people to reduce salt added when preparing and at the table. And in Asia country, we always add salt into the kit. So just reduce the sodium. And also avoid or limit consumption of high salt, like soy sauce, fats, and processed, including like bread, and the cereal. Especially cereal. We cannot imagine cereal have high sodium, but it is. And healthy diets, eating rich in whole grains, fruits, vegetables, and also pay attention to fats and dairy products. Then reduce the food high in sugar, saturated fats, and trans fats. Then very important diet, stop hypertension is DASH diet. Then I will introduce DASH diet later. But here is a very famous diet in Western country. A healthy drink. Here, encourage the patient to drink moderate coffee, green, and black tea. And we recommend they drink like here, hibiscus, or we call rosella tea. I believe in your country also you have this kind of tea. In Taiwan we call 洛神花茶. Okay, and the other juice or beetroot and the juice and the okay. Then drink moderation of alcohol. What does it mean moderation? if the patient doesn't have liver disease, but they have cardiovascular disease, they can drink alcohol. Yeah, but it should have limitation. Yeah, so the recommended daily limit is 2 standard drinks with men and 1 point women. So 1 standard drink is equals to 10 grams alcohol. So 10 grams alcohol equals to 285 cc of low-strength beer or low-strength beer, 425. So in Taiwan, we just to tell the patient 2 cans of the beer because 1 can is almost 375 cc. And equals to, if the patient they drink a red white wine, they can drink is 200 cc per day. Men and women is 150 cc. Then 30 cc of the spirits. Spirits is like vodka. Okay, and weight reduction, avoid obesity. Yeah, and alternative is the waist to height ratio is less than 0.5. Here you can calculate your own ratio and do the regular physical activity. Here, the recommendation is the activity, moderate intensity aerobic activity like walking, jogging, or cycling, at least 5 days a week. Then 2 to 3 days, and every time is 20-30 minutes. And smoking cessation. In Taiwan, we have the outpatient clinic. So if the patient they cannot the smoking cessation by themselves, we will transfer them to the clinic. Then the doctor can help. And reduce the stress and induce mindfulness, and encourage the patient to do the daily mindfulness or meditation appears to operation measurements. And from 2020, the American Heart Association they added 2 more self-care behaviors. The first one is complementary alternative or traditional medicines. So I believe in Indonesia, you also have this kind of alternative or traditional medicines. In Taiwan, we have Chinese medicine. Yeah, so many people, they go to see the Chinese medicine doctor. Yeah, but currently, the guidelines still say that large scale and appropriate clinical trials are required to evaluate the efficacy and the safety of these medicines. However, it should be a part of the traditional medicine should be a part of the self-care behaviors in cardiovascular disease treatment management. Then
sorry for
issue.
interrupting, Professor. You have 10 minutes left. Thank you.
Thank you. Reduce exposure to air pollution and the cold temperature. I think the air pollution can cause cardiovascular disease. Already have many studies to support. So this one, how to improve the air pollution right now should be important issue. Many countries. Okay, and here is the DASH eating plan. That is very famous, maybe already in America for 20 years. And it emphasizes grains and grain products, vegetables, and eats Okay. Then also eats nuts, seeds, and the dry beans. Yeah. And from here you can see they do not ask the patient to quit sweet desserts. So they still have the session is about sweets. Yeah. We can eat 5 times a week here. They have an example. Can check. And here just reminder how to measure the blood pressure check here. I think you can read this one by yourself. Especially here the cuff. When measuring the blood pressure, the cuff should be the same height with the heart, not the device. Okay. Just the reminder. And for the medication, there are several medications used cardiovascular disease, and each have their mechanism, including beta block, SCEI, ARB, and diuretics, and antithrombotics, calcium channel block, then antiarrhythmics, and antihypertensive, hypertensive agents. And so the importance is not only tell patients about the effects of the medication, also need to tell them what possible side effects could be, such as beta block. We need to monitor their blood pressure and heart rate. ACEI, it can take medication in empty stomach, and also had to treat the symptom of dry cough as the side effects, not just the omit, negate the patient's complaints. Yeah, and such as calcium channel block, need to control BP and the heart rate. Here, statin control fatty intake, and if the patient maybe will complain they have muscle ache. Yeah, so that is the side effects, but some people may need to change the medications. And so how about the anti-hypertensive therapy of COVID-19? Should we change the medications? As I mentioned, the ACE2 receptor, right? So here, studies have still controversial results, but recently published studies and meta-analysis have significantly reduced initial uncertainties regarding the use of SCI and ARB in treatment of the COVID-19 patients. So right now, the data indicate all anti-hypertensive classes are safe in this group, but we need more studies to support the findings.
I'm sorry for interrupting you again, Professor. 3 minutes
Okay.
left. Yes, please wrap up to the end slide.
Okay. And here is telemedicine in Taiwan. Yeah, I just show you we have the cloud system, and so people can check their health status, and also the clinic outpatient visit online. And here, telemedicine actually in Taiwan is not new, but in the past 2 years, which start to use it not only for the people they are home isolation or home quarantine, also can do it for some people they don't want to go to the hospital to see the doctor. Okay. Then. And we have a telenursing in Taiwan. I just skip this part. And here we emphasize the post-acute care. It's the outpatient and the home care team for CVD patients, including we have heart failure case managers. We have CAD case managers and the stroke case managers.
Hello, Professor. I think there is a technical glitch here. So please wait a minute for the stabilization of the connection. Hello, come back again, Professor. Hello? Could you hear my voice, Professor?
Can you hear me?
Yes, very clear. You can sum up the topics, please. We have 1 minute left, Professor. Yeah.
Okay. And here, it's the family support system. It's very important, the family to support the patient. Here, I would like to share with you is my heart failure patient and the family support system. I established a patient support like group, and we use that to keep the patient together and to allow them to share their experience or ask questions. And we also hold the annual patient support activity each year. Then here I established the multidisciplinary web-based interventions that is for heart failure patients. You are welcome to visit this website in several parts in patient education part. And also emphasize the COVID-19 prevention in patients with CVD, including wearing mask, washing hands, social distance, and assess the vaccination, and nutrition preparation, and psychosocial support. Here, I just want to say that because I have the patient supported, right? And so many patients, they just ask about the vaccination. Should they receive the vaccination during this time? Yeah, they just worry because so many people die after have the vaccines. Yeah, so every time we just have a discussion. Then because in our like decisions also in the team, sometimes give them recommendations. And this one is we can use this one to identify the patient's cardiovascular risk for severe COVID-19 and more severe. We recommend they receive the vaccination. So I just attach those information for you. Then you can by yourself. Okay. The final is psychosocial support, including several parts like stay informed. Need to tell people the information about the outbreak and educate our patient how to protect themselves and correct misinformation. So in Taiwan, we have our media like a television always try to emphasize and correct the information to the people and limit the media exposure is mean not just spend all the time to listen to the media and just use the trusted media outlets to gather information and anticipate and counsel about the stress reactions. Here, I think I already listed the strategy here. Yeah, you can take a look at the information. Okay, here is my session. Hi,
wow,
back to
thank
the
you so much.
moderator.
Yeah.
I'm sorry, I prepared too much.
No problem, Professor. That's very awakening and really insightful topic for us. Thank you for that excellent presentation, Professor. And for the participants, if you have any questions for Professor Sing Mei Chen, please you can add them by fill in the slide link that has been sent in the chat column Slido. Write down your name, institution, and the question that you want to discuss, and we will be able to answer some of them during the Q&A session. And for committee in charge, please share the question screens that have been written by the participants on the slide. Okay, Professor, we have a lot of questions here. I think it's very interesting discussion. From your slide here, we have one from Tiki, comes from University of Jember. And the question is, how much coffee consumption that are recommended for the patients with CVD? In contrast, caffeine could increase blood pressure. Are it dangerous to the patients? Okay, Professor, time is yours to answer the question.
I think it's a very good question. Yeah, because many patients also ask me the same question. Yeah, we try to ask them to prevent to drink too much. Yeah, but what does mean much? One cup of coffee is equal to 140 milliliter cc, 240. Yeah. So 1 to 2, maybe it's okay, but it depends on the patients. If they drink 1 cup of coffee already increase their heart rate, probably they should reduce the consumption. But I remember I have been read the article is 1 to 2 cup, so it's 240 to around 500 milliliter.
All right, so the answer is 1 or 2 cups, okay, but make sure that it's not more than that, Professor, right?
Yeah, but less is better.
Yeah, that's a good question from Dicky. Okay, can we move to another question, please? Committee in charge, please share the screen. Hello, committee, please share the screen. Okay. All right. Professor, we have the second question from Mr. Anggi. And the question is, many patients with CVD, they have difficulty in adhering the reduced salt intake, taking healthy foods and drink. Then how is the approach to empower them? Thank you. I will place for you to answer the question, please, ma'am.
Okay, I think Angie, Mr. Angie is the expert in this area. We all face this the same difficulty. Is the patient they very difficult to change their eating style, eating habit. Yeah, so you need time and also try to do the patient education when educate the patient. We need to involve the caregiver and the main person. They are responsible for the team at home. I mean, when do the patient education, we have to invite the person cook for the patient. Yeah, then have a discussion to discuss how to do dietary. I have just finished one study last year. Is about how to reduce their thirst, and so use their soft pack at home, but the result is not good. Yeah. I ask the patient to monitor their diet, so they have to wait the diet and take a picture to see what they eat every day. Yeah. At the beginning, the patient, they can continue this kind of activity 1 month. Yeah, but after 1 month, they just out. Yeah, it's not easy. So, but I think if the whole family can support the salt reduction, it's much easier to get success. Yeah.
Wow.
And
Good
also
explanation.
can
Yes, Professor.
yeah. I also have recommendation is maybe we can invite some people to share their experience. Yeah. So that peer support also can help. Okay, that is my answer.
Okay, thank you very much. That's a really good explanation from Professor Sing-Mei Chen. And yeah, I think the answer is about we have to support the family, the patient with whole family to take the reduction of salt. And also we can invite some people who can share the experience on how they can successfully reduce the salt consumption in their daily life. Thank you very much for the answer, Professor Sing-Mei Chen. Okay, we also have a question from Nabila from Gajah Mada University. And the question is there a maximum exercise limit for people with CVD? And are there any special exercises that are recommended for CVD sufferers, Professor? That's the question.
Yeah, we can use heart rate to monitor the maximum exercise. Yeah, so if the heart rate reach the baseline 60 to 80%, probably it means that it's the upper limit for the exercise. So I mean the maximum is, if the baseline heart rate is 60, then times by 80, then is how many? For 108. So if they do the exercise, then the heart rate already increased from 60 to 108. Yeah, it means already the maximum exercise tolerance for the patient. Another way is usually I teach the patient just to monitor their body, their symptoms, the perceptional symptoms. Like they feel a little bit shortness of breath. They feel start to sweat and a little bit half rush. Yeah, then that is enough. Then yeah, so they don't need to actually reach the maximum exercise limit. And every day they just do the 20 to 30 minutes exercise. The most common exercise is walking, or do some like a Tai Chi. Do you know Tai Chi?
Yeah, I've been.
It's a Chinese.
I've ever heard.
Yeah, or Qigong. Yeah. So yeah, that is enough. They don't need to go through running or very vigorous exercise. Just the moderate is good. And do not do the exercise just the right after meal. After meal, they need to take a break, 30 minutes to 1 hour at least. Yeah, then they can go to do the exercise, physical activity. to prevent to increase the heart loading.
Okay. Okay, Professor. So that's the answer for Nabila, that we can do 10 minutes for Tai Chi. It's very interesting and it's really unique. You can maybe try to implement at home, and also the limitation of the activity is upper for 80% is the maximum. Okay, thank you for the answer, Professor Sing Mei Chen. And we still have time for the discussion. Maybe we can move to another question from Rifki Kurnia from UNS Solo. Yeah. So the question is it true that COVID vaccine may lead to severity of the disease and even death, Professor? That's the question.
I believe in Taiwan, because in Taiwan our media, social media is very good. Yeah, so they can discover many issues or secrets. Yeah, I believe some people, if their condition is not stable, then they receive the vaccine. Yeah, it's possible to increase the mortality. Yeah, so in Taiwan, the government encourages people, if chronic disease is not stable, do not receive the vaccination now until the disease is stable.
All right. So that's the question for Rifki Kurnia. We can move to another question from Isan UGM. And the question is, nursing intervention is include biopsychoculture, self-care, tele, and family or biopsychosocial in Taiwan. Is there any culture that can disturb intervention, Professor?
I believe, yeah. Currently, I do not truly have the experience the cultural issue in just interrupt intervention. Yeah, but the people they just refuse to the intervention. Yeah, so sometimes when they do, we request them to, like okay, they need to eat more meat. Maybe the patient have anemia. I mean the HB is low, then they have anemia. So we ask them to eat some contains high protein and very very thin. But some people they may refuse because their religion or their belief, they believe that is not good for animals' life, something like that. It may refuse. But in Taiwan, the cultural issue currently is gradually decreased. But some people may say, okay, I need to ask the guard first. Yeah. So if the guard say no, then they will refuse. Yeah. So we still have a cultural issue, but not a lot. But I think a cultural issue in Indonesia is very important. Yeah. So because I have so many Indonesia students or friends, yeah. So I know this issue in country is important. You need to solve the problem.
Yeah.
Yeah. For example, for the vaccination, some may think that it contains pork. Yeah. So they may refuse. Okay.
All right. That's the good explanation from Professor Sing Mei Chen. And maybe we don't have any questions left for the participants who wants to ask a question. You can activate the raise hand button and reaction, and you can address your question directly to the professor. We have still 1 minute left. Okay, so I think there are no more questions from the participants here. Thank you very much for Professor Sing Mei Chen. It's a really fruitful discussion with you today, and also all the participants who actively engaged during the webinar. And after that, we will listen to the very interesting explanation of the material and also discussion from our first speaker, of course. Friends here are still very excited to hear material from our second speaker, namely Mr. Anggi Lukman Wicaksono, registered nurse, MS, with the topic Controlling Sedentary Lifestyle for Preventing and Managing Diabetes mellitus. And please let me read the CV of Mr. Anggi.
Excuse me.
Yes, Professor. Yes, Professor.
Excuse me.
Yes, Professor.
Yeah, because I am teaching in a hospital. Yeah, so I need to leave.
Yes.
Just say thank you for inviting me. Okay.
Thank you.
Okay,
thank
so
you very much for your time, Professor, and have a good time.
Thank you,
Stay
Professor.
stay healthy, Professor.
Thank you,
Thank
Professor.
you.
Bye-bye.
Bye-bye.
All right, we can sum up the agenda, and the next agenda is the curriculum vitae of Mr. Anggi Lukman Wicaksono, registered nurse, Master of Science in Nursing. So please, for the committee in charge, share the screen for the CV of Mr. Anggi. So Mr. Anggi Lukman Wicaksono got her Master of Science in Nursing from National Cheng Kung University, Taiwan, with excellent GPA score in 2016, and also got the registered nurse from Erlangga University, Surabaya, Indonesia at 2011, and also got his Bachelor of Science in Nursing at Erlangga University, Surabaya, Indonesia at 2010. And I would like to share you his working experience. Mr. Anggi Lukman Wicaksono, at present as faculty member, assistant professor, Department of Medical Surgical Nursing, Universitas Gadjah Mada, Indonesia, from August 2012 to present, and as head of Genius Center FK-KMK or Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, and also Task Force Team for Health Promoting University, Faculty of Medicine, Public Health and Nursing, Gadjah Mada University from January 2018 to present. And he also have several honors and awards. One of them is awardee Type A TMU International Student Scholarship for Doctoral Program, and Best Paper Award Field Health and Drugs, Ministry of Research and Technology National Innovative Board for Research, Republic Indonesia, the shortlisted delegation of Transform Leadership Program for Adolescent Health in Indonesia, NCD Prevention to University of Melbourne, Australia, in 2019, and also have several publications, both international and national paper. One of the international publications that recently in 2021 is entitled The Attitude of Healthcare Workers on Enhanced Recovery After Surgery for Cesarean Delivery, a Scoping Review, Journal of Obstetrics and Gynecology, Canada. And I think that's all from our second speaker here. And the last is for the national publication from Mr. Anggi is entitled "Why Do We Need to Empower University Staffs and Students for Tackling the Non-Communicable Disease?" And at present, he also has several training and workshops, such as Genos Training for Trainers, Diabetes Educator Workshop at Jakarta, Diabetes Meeting, University of Indonesia, and at 2020 has research writing and publication workshop webinar Elsevier Southeast Asia. Well, that's a very wonderful brief introduction from Mr. Anggi Lukman Wicaksono. And without any further ado, please welcome Mr. Anggi Lukman Wicaksono. Hello, Mr. Anggi.
Hello, Rere. Nice to meet you.
Nice to meet you, Mr. Anggi. How are you, Mr. Anggi?
Oh, feeling great. Thank you.
Yeah, how do you feel to be the speaker in this webinar, Mr.
Okay,
Anggi?
it seems I'm the last speakers. Then I need to go back and bring back all the previous speakers, but I will focus on my topic on diabetes, of course.
All right. Yes, we have the expert in diabetes, also in endocrinology, Mr. Anggi here. It's very nice to have a discussion today. So before we start to present, I would like to inform that the presentation is in 30 minutes. And for the participants who wants to ask, you can write down your name, institution on the Slido that the link has been sent from the committee in charge in the chat feature. And all right, I think that's all from the brief explanation. And this is Mr. Anggi Lukman Wicaksono, registered nurse, Magister of Science, will deliver the topic Controlling Sedentary Lifestyle for Preventing and Managing Diabetes mellitus. Mr. Anggi Lukman Wicaksono, time is yours.
Well, thank you for the warm greeting and also the introduction, Rere. It's an honor to have a speech for this excellent forum. I would like to express my gratitude to all the committee and also School of Nursing, Universitas Gadjah Mada, for having me for this agenda. Okay, I would like to share my screen. Okay, is it now visible and audible?
Yes, it's visible clearly and audible, Mr. Anggi.
Okay, perfect. Yes. Given the topics for today, I will have a kind of speech related to controlling and managing a sedentary lifestyle for patients with the diabetes, and I would like to provide some best practice to us. In general, I will focus on two main topics. First, in managing the sedentary lifestyle, and the rest is preventing sedentary lifestyle for high-risk people for the diabetes. Okay, I will go forward for the COVID-19 and the diabetes and the impacts for the current situations. The diabetes itself, as the Prof. Yayi mentioned, is one of the major chronic diseases. And currently, it's the second most prevalence of the NCDs. It's about 10 to 20%. That's the number from the global issues. On the other hand, the presence of the COVID-19 become another emerging diseases. And as we know, several studies had stipulated that being a patient with the diabetes is the increasing risk, about 2 to 3 times having a COVID-19. So when patient with the diabetes having or infected with a COVID-19, it's become a burden and a high number. I could say double or triple burden having severity and also mortality. There are several studies, and also our team fortunately have kind of a review and show that kind of the data. In terms of that, diabetes is well-managed diseases. If we can control, of course, it's decreased the mortality rate and also the disease severity. Of course, it relates to quality of life and the well-being. On the other hand, if we fail to manage or having a problem about COVID-19 and diabetes, it will directly improve and also increase the mortality, morbidity, and of course, a dying risk. In the right side of the chart, you can see that is the chart of the data. I think it's the global data in the world. I suppose it's come from the systematic review data. It's showing that before the pandemic or before COVID-19, and for the light one, white, and the black one is for after the pandemic. We can see that there is an increasing pattern of the diabetes, about 11.1 million. And the rate of cause mortality for diabetes patient also increased about 1.7 during or after the pandemic coming to us. To our knowledge, the diabetes and physical activity is quite engaging. Physical activity have such kind of the mechanism, as you can see in the figure, that the reason why physical activity have the benefit for both preventing and also managing the diabetes itself. So it have a positive impact for the glycemics and also metabolics indicators, and also it have improving the function of the insulin. That's why the insulin of the insulin inside of the patient body getting more sensitive and more active. Okay, that's also the data from the Italy, a study with a type 1 diabetes patient for the young adult and children. We can see from the data, the dark one is before T0 is pre-lockdown, and the light one, the white, is after lockdown or the pandemic. We can see there is increasing sedentary lifestyle from at the previously more children having sport more than or equal to 3 hours for this side, this one, the upper one. But after the pandemic, there is a moving from the left one to the right, from the right one, move to the left one. It means the patient with type 1 diabetes also have a problem and have a lower physical activity. Okay, coming back to physical activity and physical inactivity, I can say that all of our activity during pandemic mostly are study from home, working from home, leisure time, watching television, mostly are a bit limited physical activity. Of course, this situation will have direct effect for the diabetes management itself, and also the indicator, particularly in the cardiometabolic and functional parameters. I think when we are talking about diabetes, not only talking about glycemics indicator, but also think about metabolic control, metabolic indicators, further complication, and quality of life. That's why, on the other hand, I think the physical activity is improving our quality of life among patients with diabetes. For the left sides, it's almost we know as the sedentary lifestyle behavior. Okay, I will go further about what is the sedentary behavior or sedentary lifestyle is. According to WHO guideline, it's knowing that the sedentary behavior is any waking behavior, meaning that any activities that characterize as energy expenditure less than 1.5 of maths. Maths is one of the saturation or the solution for the metabolic equivalent type of system. So there is a system how to measure but the physical activity. When the MET is less than 1.5, it's mostly a waking behavior that showing a sedentary behavior. What's kind of the activity? For instance, like sittings, lying, most desk-based office, study from home, working from home. Mostly we do with desk-based office work. So it's a very crucial for current situation, particularly for patient with diabetes or high-risk person. Driving car or even wheelchair user, our friends with disabilities, they also have a problem with a sedentary behavior because that is the common one for the sedentary behavior. Okay, then how the recommendation? The WHO already stimulate about what should to do for the sedentary behavior. The regular exercise is the keyword. If you do exercise, it will benefit, but the significant benefit will you get when you get regular physical activity. It have a it have a strong recommendation, very rigorous study. Or you can choose about 150 to 300 minutes per week with moderate intensity of the aerobic for the type of the physical activities. Or you can also combine with the vigorous, meaning that you can use aerobic or muscle training or flexibility training about 75 to 100 minutes per week. For the management, it's mostly a tailor-based, so you can adjust based on your time. For both, you can choose one of them, and it's based on what's your activity and your capability. And for that, also at least 2 days per week, it's recommended to have moderate intensity for muscle strengthening. It's mostly having the activity with complex or multiple muscle using. So for instance, farming, gardening, it's also helping. Or if you can go to the gym, it's also recommended. But somehow people with the diabetes might have limitation with that. For the rest, patients who have diabetes and cannot do physical activity, that's okay, but keep inactive. When you are unable, please do the physical activity as long as you can. So there is no reason to not to do a physical activity. That's the recommendation. Of course, for this situation is conditional if you are not in good condition. And try to start from the small accounts, then increasing gradually. It's also recommended to combine, like I said before, aerobic and muscle strengthening and flexibility. And if you are feeling well and feeling fit, you can increase the number of the physical activity beyond 300 minutes per week for moderate or 150 minutes for vigorous intensive aerobic. The vigorous means you can have several kind of the aerobic physical activity. Then what's the best practice? The study tells us that physical activities improve biomarkers in the human body, particularly for the diabetic indicators like A1C, blood pressure, body mass index, and the lipid scale cell. And this is the study from the Sadarangani et al. 2014 is quite new for the diabetes. And our study tells us that the tailored physical activities with a frequency 3 to 5 days per week, it's very recommended with a minimal 30 minutes per day. Or if you can do for this kind of the recipe, you can adjust by having a 10 to 15 minutes for using a small portion, but achieving again 100 of the 50 with intensive, moderate intensity of the aerobic exercise. It will have a vast benefit for patients with the diabetes. Again, the study also showed us that if you are being active, at least you have a 32% reduction of being reducing, right? Reducing the risk for the cardiovascular diseases compared to those who are not active. But if you can achieve the WHO recommendation, the physical activity guideline or above, you can have about 40% of the reduction, meaning that if you are getting cardiovascular disease of mortality, you can reduce it about 40%. It's a big number because as Prof. Singh explanation, cardiovascular is one of the major, and behind that, diabetes is the reason. Okay, I will talk about the benefits. Of course, it has many benefits, particularly for maintaining your healthy weight, being sensitive for the insulin, and also reducing the risk of the heart disease. And the good thing, the physical activity can reduce stress because it's kind of the recreational and fun activities. I think that's the common thing. Then what should the diabetic people can do for the physical activity? Whatever the physical activity that making you moving, it's good. That's the key. But I can say that you may choose from your hobbies, what your favorite. For instance, like walking or swimming or having exercise bikes or dancing, line dance or etc. Maybe it's also good for you to start with. Golfing, gardening, water aerobic, tai chi, yoga, it's recommended. I'm very like for these slides because this share about the message, endurance, spirit, and also happiness doing the physical activity. It's done by our friend in the Diabetes Australia. They also promote to have kind of the fundraising. They're collecting the fund, and then they share it and showing that we need to do more about physical activity. And for Indonesia, we also have kind of this activity. I think we have actually we will get in touch in this year as well, because in 14 November, the day of the Diabetes International, I will show you this is the physical activity that done by non-government organization, Gendis Manis in Yogyakarta, one of the pilot study. And it's also conducted during the pandemic. So the pandemic does not limit us to do physical activity. Just last year, 2020, I believe. Kita persiapkan masker, hand sanitizer, kita lawan diabetes. Selamat pagi. Untuk mencegah dan mengendalikan diabetes. Dari Pos Dindu Kajar Lestari. Peringatan hari diabetes sedunia. Semangat semangat. Sehat mencegah diabetes. Kita semangat ibu-ibu, semangat. 5 pilar pengelolaan diabetes lawan DM. Lawan dari diabetes ke dunia. Okay, so we are waiting for your contribution for this year. Although this is still a pandemic, but we still can do a lot of things to promote physical activities. But remember, when you have feeling unwell, you may think to delay or to cancel your physical activity because it might be a sign that you need to understand yourself. You need to listen what your body tells. That's might be for the recommendation. You need to check for the cotton bodies in the urine or also the blood. Taking the blood in the laboratorium, then see what happened with you. Probably you have a high range of the blood sugar level. Or if you are at home, you can, if you have a blood sugar check machine, you can check your status of blood glucose. If less than 100, it suggests to consume carbs first before you're doing a physical activity. But if the result is more than or equal to 250, please make a consideration to do physical activity. Cancel it, it's more better. Some of the tips for the physical activity during the pandemic for a patient with the diabetes, keep the hydrated at least a liter per hour, taking extra carbs before, during, and after, monitoring blood sugar, and also you may reduce your insulin dose, but of course you need to consult with the doctor or the family physician you have. Wear it for the sunblock and keep the mask because we are still in the pandemic. Okay, for the next issue is related about the food care during the exercise. I think the diabetic foot ulcer is the one of the serious cases for patient with the diabetes. Then you need also to consider into it. You have to inspect your feet regularly, at least once a day, to make sure you have no wound or any others problem with your feet. And also exercise, it's recommended to avoid exercise who having stress to your feet. For instance, like running, but transfer it, move it to the stress, no stress for feet. For instance, brisk walking and also bike, it's a little bit comfortable. It's also big concern to patient with the diabetes to use a comfortable and well-fit shoes because it will protect and help your feet safely. Okay, this is the summary of the how we reduce a sedentary behavior as the WHO guideline. I got it. This is the current study from the Marshall et al. The review. They have a very good review to show us at least being an active. If you have kind of this webinar, try to stand up to make your body standing. For instance, after 2 or 3 hours. So I think maybe after that we need to get some exercise, not only intellectual input, but also a physical activity. And also take a break, a short break. If you have family, you can play with your children during the meetings or during the lecturing like that. Or you can also have kind of sightseeing by walking, just brisk walking around your homes. That's kind of it. That's from the patient with the diabetes. And how for a patient with high risk? Who is a patient with a high risk group for the diabetes? A high risk group for the diabetes patient, it means that you have a risk factors that in yourself or situation that you are having. For if you are not doing well, you will become a diabetic patient. Mostly we call it as pre-diabetics. Who are they? Older people age more than or equal to 45 years old, younger with the overweight, obesity, BMI more than 23, patient or a person who have first family history. For instance, your father or your mother, so you means you are first a family history, but your grandparent and your grandparent or grandmother or grandfather, it's knowing as the second family history, but the direct risk is for the first family history. Furthermore, for the gestational diabetic during the pregnancy, patients who have anomaly for like impaired glucose intolerance, hypercholesterolemia, dyslipidemia, hypertension, and sedentary lifestyle, what we talk currently, and unhealthy dietary practice. So for those persons who have kind of the situation who are being a high risk, then what is the recommendation for them? Of course, the purpose is to prevent them being a diabetes as soon as possible. So we have to cut the age and then make it more active. The recommendation is similar to prevent for a high risk group population. If you are not unsure about yourself, you can use this kind of the website. This is from the Diabetes Australia. They provide a kind of interesting calculator. I think in UK also they have Diabetes UK, but I think it's most bit complicated, but complete, fun and interactive. They will provide you a risk level for low, moderate, high to very high risk. Then you will getting know about the recommendation provided. Okay, this picture shows us about those respond about the curve. The baseline is the weekly physical activity in minutes, and the vertical is health and fitness benefits. From the several study, consensus, and many diabetes experts, they suggest people who have a high risk, you have to very active for. It's recommended in this area. The green one. 150 to 300 for weekly physical activity. In this picture, we can see that the risk is getting lower for this one, but it increasing after more than 300 minutes. It's mostly related to the intensity and also the duration of the physical activity. But for the benefits, if we see the benefit, the impact to our body, it have the very gorgeous effects. It have increasing. But after that, for this one, there will be a plateau, the stable benefit. So that's why the recommendation is between 150 to 300 with intensity, moderate intensity. That's that we got from the many study about the physical activity. Then this is the one of the best practice that I found in the study. They tell us that if you set at least about 4 hours, just count yourself. You join about the webinar from 8 to currently it's more than 4. It increase. It have increased risk, of course. Increased risk of being dying. So that's why we need to get more active and avoid for the sedentary lifestyle, sedentary behavior, because when you are more active, you are less risk of the die, as this picture. The red one, it's when you are in the high risk, but if you are more active, more having a physical activity, so we'll get a lower risk for being a death. That's the study, I think, from the Ekelund, also a systematic review in 2016. But if you can achieve moderate to vigorous intensity of the physical activity for 60 to 75 minutes a day, the risk of getting die, you could eliminate, get rid of. So it means you can prolong your age, your life like that. So being active is also related. It is associated with high age or higher age. Okay.
Sorry for interrupting you, Mr. Anggi. We have 5 minutes left.
Okay, I will have 2 more slides. Thank you.
Thank you.
Yeah. Okay. For the rest of my slides, it's about take-home message that we can take for this. It might be the last 2 slides is the summary of all my speech related to preventing and controlling sedentary lifestyle or sedentary behavior among diabetes patients. So remember that a patient with diabetes, it's strongly recommended to have an active physical activity for at least 150 to 300 minutes with a moderate intensity aerobic. Aerobic might be brisk walking, line dance, and kind of dance. It's fine of this, swimming, and also kind of several cycling. It's also a part of the aerobics part, or mostly are dancing or moving your body. That's the aerobic one. Or you can choose using a vigorous intensity. If you don't like only aerobic, you can have several kind of the aerobic physical activity for 75 to 150 minutes per week. This picture are each week, not per day. And if you are capable to do more, it's recommended as well to have 2 days, at least 2 days in a week, to have a muscle strengthening activities. Okay. And try to limit your sedentary behavior for the simple way. During the lecture, during the webinar, you may have a strict, after 3 hours, you may need to standing or having kind of the side sitting, walking around your course, your dormitory or your homes, then you're more being active, and replace it to the physical activity with any kind of the exercise that you like that. Okay. Yes, in the end, I just want to say to all of you that during the pandemic, physical activity is one of the great challenge for us, particularly for patients with diabetes or a high-risk population for diabetic people or pre-diabetic people. But I would like to express what's the Prostadina message. She is a type 1 diabetes survivor. She's from Greece. I met her in 2019. She is a very active and very wonderful young girl who have diabetes, and seems no problem. She can live well with the diabetes, means that we also can do that. I think that's the message, and I need to share with all of you. Then we can be more and more active. Okay. I think that's all from me. I hope there is insight that you can take from my lecture. And again, we wait for the contribution for being more active and engaging for any kind of the non-communicable diseases activities in Indonesia or in the global context. Thank you very much.
Oh, thank you. That's a powerful message from Mr. Anggi Lukman Wicaksono. And it's a really good explanation and insightful topic. Thank you for Mr. Anggi Lukman Wicaksono, registered nurse, Magister of Science, for that excellent presentation.
My pleasure.
And yeah, because the pandemic makes us less engaged in outdoor activity and possibly drive us into a sedentary lifestyle. So I think this topic is really applicable for us in this pandemic situation. All right, for participants, if you have questions for Mr. Anggi Lukman Wicaksono, please raise hand or add your question by filling in the slide link that has been sent in the chat column. It's Slido, and write down your name, institution, and question that you want to discuss, and we will be able to answer your question after the Q&A session. Okay, for the committee in charge, please share the question screen, and we will try to read out loud from the participants. Okay, Mr. Anggi, we have several questions here, and we are really interested to discussion more with you, Mr. Anggi. So the first question comes from Diki, University of Jember, and the question is, for best evaluate when we should checking patient's blood glucose, how it means the patient's pathway. That's the question. Time and place is yours.
Okay, the question about what is the best time to checking the patient blood glucose, right?
Yes.
I think it's in general, not related to physical activities. in managing a patient with the diabetes, there are best time to measure your blood sugar, and it's depend on the situation. But in general, I could say that one of the best way is in the downtime for us in the subuh, in the before we getting a breakfast. So after we are awaking for the sleeping, that is the best time to check the blood sugar. And it's for this situation, it's knowing as fasting blood glucose. So because the situation or the indicator will be different if you check random or fasting blood glucose, or maybe prandial 2 hours after getting 5 grams to 10 grams of the glucose. So the best recommendation is in the downtime at the subuh. So you can check the blood glucose. If you are in the range of 100 or less than 125 milligram per deciliter, it's mean the diabetic patient, the blood glucose is controlled. But if it's higher, you have to evaluate yourself. Probably the diabetes management did not working well. So we need to evaluate what's the worst, what's the problem, and we need to fix it. That is the best time. But if you can do that, you can still check by random blood glucose level. But of course, the indicator will be different. I think so. That's what I learned from the several studies.
Very good answer from Mr. Anggi. So that's the answer, Tiki, that the good time for evaluating the blood glucose for DM is at downtime or at subuh, and we have to make sure that we check blood glucose before breakfast. So that's for Diki. We can move to the next question. The second one is from Yomi, Gajah Mada University. And the question, is there any difference in the recommendation for physical activity in patients with diabetes mellitus according to age?
Okay,
thank you, to answer.
Yes, I think that's a good question. I only talk about adult and elderly. That's my one of the expertise on the age. I will not talk too much on the area that I'm not expert on it, because I'm afraid that I would like to be frightened or having error information. But thank you, Yomi, for bringing us these questions. As in the WHO recommendation, it have a specific recommendation based on the age level. So if you are adult and elderly, so it's one cluster. And another one, if you are a children, for instance, 5 years to 18 years, you have a different recommendation. The types is similar, moderate or moderate to vigorous intensity. That is the recommendation. But the time probably a bit different. I'm sorry that I could not share a lot, again, because that's beyond my expertise, so I will not talk too much. But I could make sure that there is a recommendation, the best practice for different type of the age. But I can remember that the similarity is on the intensity. But I believe that a children is more active than adult, right? If you see a children meet another child, they will engaging and just being playing and being active. It's different with us for adults. I think somehow adult is more getting sedentary compared to children. That's my perspective. But of course, we need still to promote the children, particularly children patient with the diabetes, to get more active.
Okay, so for the moderate physical activity level, that's the answer, Yomi. So, okay, we next move to the third question. It's from Anonymous. Does people with bad dietary habits rarely eat has a higher risk of diabetes mellitus?
Sorry?
Does people with bad dietary habits, that people who rarely eat, has a higher risk of diabetes mellitus, Mr. Anggi?
Okay, yeah. Thank you. As I mentioned that unhealthy diet is one of the high risk of being a diabetes mellitus. It means that you have a one risk. I always give an example to my student that if you have a high risk, meaning you have one problem, one weapon in your body. Just imagine that you put a granite in your belly. If you are practicing unhealthy diet, means that you have one granite or 1 point for the risk factors that it can done. It can be it can be being a problem at many times. So of course, when you are a bad habit, for instance, like instant food or unhealthy or fast food, it's unhealthy diet, of course. Not having or not consumes veggies or fruits as the recommendation, 2% for the fruits and 3% for the veggies. So if you not do that, it means you also have the risk. In the post-bindu, in the context of the non-communicable disease, we make it kind of the identification. If your habit is like that, you are in the red. It means that you are in the risk, and it will getting a problem with the diabetics for the several times, maybe next 5 years, 10 years, or maybe next years, like that.
All right, that's the answer for Anonymous. So maybe we can move to next question for Ado, Gajah Mada University. And the question is, what is the example of moderate aerobic physical and vigorous aerobic physical?
Okay, so I think for both, it's the moderate intensity, but one is the moderate intensity in aerobic, but the next one is a vigorous physical activity in aerobic. So that's the two terms. The moderate means that you are in the middle. For instance, in terms of the duration, it's about 150 and 300 minutes per week. So that's in the middle part. Or another thing that's you only increase the heart rates, as the previous explanation from Prof. Singmei. They mentioned about the increasing for the heart rate no more than 60 or 70. I think for the older, it no more than around 50. So 50 to 60, it's the limit, the threshold for the increasing. That's known as a moderate intensity. For the types of the physical activity, it's vary. Like a dance, golfing, gardening, swimming, cycling, brisk walking, aerobic swimming, like the picture, yoga, tai chi. It's mostly are aerobic. So you just need to adjust time, durations, and your time. I mean, you can make a recipe for the whole 30 minutes a day, probably for 5 days, or you can make a small portion. It's based on your eligibility. Yes.
All right, that's very good explanation from Mr. Anggi about the type of the physical activity. All right, we have question from Mashita USB. Is there any still exercise for women has diabetes mellitus? Oh, I think it's for in late age, yeah. In 56 years old, hard to stand and walk, only sit even for cooking, shaded by sit. Or maybe she tries to question about the activity for late age for old. How does it can we implementation? How can we implement for them? Maybe that's the question, Mr. Anggi.
Okay, I think the woman 56 is still adult, maybe, but the late adult, not
60,
still not
yeah.
right, not elderly. If I'm not mistaken, catch up with these questions. The Mashita asking about what is the exercise for women in the adult age with limited have
ability
hard
to
to
move.
stand and walk, so have limited for physical activity. Sorry if I'm wrong, catching up with the question, but my response is for the adult, it's no matter you are male or female, it's the same. The recommendation from the WHO, the study from the best practice also recommend the same thing. So you are male or female, it's the same. But the situation may be different because this person or this woman having a limited physical activity could not standing, right? Before answering this question, we have to consider whether this patient obese or not, overweight, obese or not, whether they have a central obesity. The obesity only focus in the abdominal, not the whole body. We call it as the central obesity, because when we adjust the physical activity for people with the obese central obesity, it will a bit different, because the patella or the support her leg probably vulnerable. For this case, the woman mostly doing the activities in sitting, right? So probably the best one, I go back to the recommendation from the WHO. If you have a limitation, if you have unable to do more physical activity, do whatever you can do based on your situation. But still, you have to be active. That's the key word. So for this patient, I will recommend that you can use kind of the activity exercise by sitting. I believe that there is an exercise and with sitting, so we still can sit, but we can still moving our upper side or maybe our lower side using the whole body movement. So we can have kind of this activity. The next one, the woman can use yoga. So yoga for the breathing and also for the activity. It's also can doing by sitting, so it will be applicable. And maybe another one is kind of the relaxation meditation. It will also help. Somehow, Tai Chi is mostly we have to standing to do or to perform some the movement. But I think it's also still workable if you are sitting or lying in the bed. And it means that we have still many choices. Okay.
All right. So the keyword is we have to move as possible as we can, right?
Right.
So yeah, that's the explanation from Mr. Anggi. Do we have any more questions? Please, committee, you can scroll down the screen. All right. We have one question left from Ita. UGM, what about OCD, obstructive disorder? Is it okay to do that in a long lifetime? Because I heard that like the people who wants to do diet but still can eat anything they want. That's the question, Mr. Anggi from Ita.
Yeah, I think that's interesting question. I think OCD is kind of mental health issues or some of the belief or thinking that I feel not calm or feeling not satisfied with yourself. You're doing diet, but you still want to do more. You're not satisfied enough. To respond for these questions, it's a bit hard. I think we need to before going through to the physical activity or diabetes management, we need to consider about the OCD itself, whether is it appropriate or not. I think if you are going more, I mean that's extremely, it will become a problem or disease. I think the best way, the best one is in the middle, like one of the probes in the Islamic or the Islamic scholar yeah, put it in the moderate level, not too low, not too high, because extremely it will be endanger your body or yourself. So I will put this quote to answer the question of the ITA, from the ITA, that maybe if you are too more having worrying, extremely worrying about what you do in diet, it becomes a problem on you. Just followed what's the dietitian recommendations, followed the best practice we found. It will be the best area for us. I think we need to consult with the expert. That is the best way. Don't make yourself getting down because of you are not satisfied enough with your situation. You are not happy with your body. Try to do whatever you can, but not too much, because again, extremely good, probably not good. I think that's my answer for this question.
All right, so that's the answer for Ita, for the patient with obsessive compulsive disorder. Yeah, I think there are no more questions, Mr. Anggi.
There's still
for
one
this.
more, I think, Lily. Can I just respond? Or time
we have no minutes left, Mr.
Okay.
Anggi. So sorry for the anonymous one. We can answer your question. I'm sorry. So, okay, time's up. We would like to say thank you to Mr. Anggi to answer the question very clearly and very interestingly. And I think that's the discussion. After that, we would like to conclude a little from the material presented by our two speakers at Hilarius 2021 webinar. The first material is from Professor Sing Mei Chen. The first one is that the heart attack and the CVD is the first killer in the global, and we have two best intervention that can implement for patient with cardiovascular disease. The first one is for self-care behaviors like reducing the salt consumption, healthy diet, healthy drink, moderation of alcohol consumption, weight reduction, regular physical activity, smoking cessation, implementation of CHAM or complementary medicine, and reduce stress. And also the second one is telenursing, and the third is family support system. That's all from Professor Sing Mei Chen, PhD registered nurse. And the second topic is from Mr. Anggi Lukman Wicaksono, that they sedentary behavior is high risk group for diabetes mellitus. And the physical activity can improve quality of life of diabetes mellitus patients. And the key recommendations is for regular physical activity from at least 150 to 300 minutes, weekly physical activity, moderate to intensity level. Example like aerobic. And also, for vigorous activity, we can do 75 to 150 minutes, like tennis, for example. And don't forget to do foot care at least one time per day. That's all from our conclusion to this webinar from today, from our expert speaker, that Professor Sing Mei Chen, PhD registered nurse, and also Mr. Anggi Lukman Wicaksono. I am Regita. Thank you all for speakers today, and thank you for attending this session. And also I would like to say thank you for all the participants who actively engaged during the webinar. Next, I am Regita Maharatri. As the moderator, I would like to say goodbye to all of the participants of webinar Hilarius 2021. Thank you for the extraordinary enthusiasm from all of you. Please apologize for any mistakes I made. Enjoy the rest of the International Hilarius 2021 webinar. Good afternoon and see you. Wassalamualaikum warahmatullahi wabarakatuh. Return back to MC.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Regita, for successfully guiding this session. And also thank you for Professor Chen and Mr. Anggi as speakers who have presented extraordinary and wonderful materials. Next session, there will be delivery of certificates and documentation to the speaker and moderator. Okay, the first certificate, we'll hand it over to Chen Xingmei as the first speaker. The committee in charge is welcome to show us the certificate, please. Hello? Okay, thank you for Professor Chen for engaging and enlightening knowledge today. Okay. The second certificate will be handed over to Mr. Anggi Lukman Wicaksono, Bachelor of Nursing, Nurse Master of Science, as speaker. The committee on duty is welcome to show us to present. Okay, thank you, Mr. Anggi, for insightful knowledge for today's session.
Thank you so much. I really appreciate it.
Now we will document today. Please, 1, 2, 3, cheers. Okay, thank you very much, Mr. Anggi.
You're welcome.
The third certificate will be submitted to Mbak Regita, Bachelor of Nursing, as moderator. Thank you, Regita, for guiding this session successfully.
Thank you. My pleasure.
Okay, sure. Now we will document it. 1, 2, 3. Thank you very much. Once again, thank you for all the speakers and moderator on this wonderful event.
We would like to remind all the participants to fill out the attendance link as one of the requirements to get a certificate. And next, we will hold a group photo session as a documentation of the event. So the committee in charge is requested to access this photo session. Please, okay. If it's possible, please turn your camera on and give your best smile. We will wait for a minute to wait all the participants to turn on their camera. Okay, I think everyone is ready. I will count for 1, 2, 3 to take a photos. All right. 1, 2, 3. Yes. Okay. The next slide. 1, 2, 3. Cheers. Okay. The third slide. 1, 2, 3. Cheers. Okay. For the next slide. 1, 2, 3. Cheers. Yeah, the next slide. 1, 2, 3. Yeah, the sixth slide. 1, 2, 3. Okay. 1, 2, 3. Next. 1, 2, 3. Cheers. And the last screen. 1, 2, 3. Okay, thank you, everyone. Well, to the speaker and also the moderator, if you have other needs, you are welcome to leave this room. Thank you again for the knowledge that has been given.
Okay, next, like what have been informed before, there will be awards for the most active participants. And now we will announce the most active participants. Okay, so there will be 3 participants. 3 participants who will be chosen. Who will it be? Anyone can guess? Okay, I think everyone is curious as well. So Deskan, please announce it.
All right, so for the first most active participant goes to Ludiro from Atlanta University.
Yay.
Congratulations.
Congratulations, Ludiro.
Okay, and the second most active participants goes to Dicky from Jember University. Yay! Congratulations for Dicky. And the last most active participant goes to Maisita from USB. Please, after the session, you can contact the committee for the giveaway. Once again, congratulations for all the most active participants in the session. Yay! Entering the last event, which is closing. Once again, we would like to thank the speaker, moderator, and also all the participants who have watched the event from beginning to the end with great enthusiasm. And now, me, Deskantari Murti Arisadewa, and my friend, Aurum Etsa, as the Master of Ceremony, we will end this webinar session. And don't forget to all Hilarius finalists to join closing ceremony at 1:30 p.m. this afternoon. Good luck. See you again. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you very much, everyone.
Thank you.
Maybe it's the way you say my name. Maybe it's the way you play your game. But it's so good. I've never known anybody like you. But it's so good. I've never dreamed of nobody like you. And I've heard of a love that comes once in a lifetime. And I'm pretty sure that you are that love of mine. 'Cause I'm in a field of dandelions, wishing on everyone that you would be mine. And I see forever in your eyes. I feel It gets so hard to breathe when you're looking at me. I've never felt so alive and free. When you're looking at me, I've never felt so happy. And I've heard of a love that comes once in a lifetime, and I'm pretty sure that you are that love of mine. 'Cause I'm in a field of dandelions, wishing on everyone that you'd be mine, mine. And I see forever in your eyes. I feel okay when I see you smile, smile. Wishing on dandelions all of the time, praying to God that one day you'll be mine. Wishing on dandelions all of the time, all of the time. Dandelion, into the wind you go. Won't you let my darling know? Dandelion, into the wind you go. Won't you let my darling know that I'm in a field of dandelions, wishing on everyone that you would be mine. And I see forever in your eyes. I feel okay when I see you smile, smile. Wishing on dandelions all of the time, praying to God that one